And for more now on the COVID crisis in Los Angeles, we're joined tonight by Dr. Elaine Batchlor, the CEO of Martin Luther King Jr. Community Hospital in South LA. That hospital primarily serves low-income Black and Latino patients. They've now set up triage tents to handle the overflow of COVID patients and even turned a gift shop into a treatment room. Dr. Batchlor, thank you so much for joining us tonight. That really paints a picture of how dire a situation this is. You currently have more patients than hospital beds. How do you tackle that? And are you able to transfer your patients to other hospitals?
We have converted every conceivable nook and cranny in the hospital into patient care space. We have 5 tents outside of the emergency department that we're using for triage and patient care. We've converted the emergency department waiting room into patient care. We are boarding intensive care unit patients in our emergency department. We've converted our post-surgical unit into intensive care beds. We're doing everything that we can to accommodate an ever-increasing number of patients that are coming to the hospital. Unfortunately, we've had great difficulty in transferring patients to other hospitals. This has been a problem for this hospital for many years. Most of our patients are publicly insured, either through Medicaid, Medicare, or uninsured, and it's been very difficult to transfer them under normal circumstances. And now that we've got a COVID pandemic, it's become even harder.
Wow. And Dr. Batchlor, you have been in healthcare for some time. So how is this crisis different from others that you've seen over the years?
Well, we've really never seen a crisis of this dimension during my professional career. And I started my career when AIDS was emerging and was becoming a huge problem. This is even larger than that crisis. It's affecting our entire community, and in particular, low-income communities of color. The social conditions that our community is living with every day has made them vulnerable to the impact of this disease.
And you say it's the social conditions that have made them vulnerable to the impact. Your hospital is seeing a COVID positivity rate of about 25%. Tell me more about those social conditions and why you think that this community has been so hard hit and what resources you need right now to meet the challenge.
So the impact that we're seeing right now is sort of a classic public health story and public health crisis. The essential workers that we often hear about, the people who stock the grocery stores, drive the buses, clean up, those folks live in our community and they're continuing to be exposed through their jobs. They also live in housing that is more crowded. It means that if one member of the family gets COVID, they're much more likely to transmit COVID to other members of the family. They also have a higher prevalence of chronic illness, diseases like diabetes and heart disease that make you more vulnerable to having severe COVID. Our community is missing 1,200 physicians. We have the lowest number of hospital beds in the county. And even before COVID came, we had an epidemic of poorly treated chronic illness. All of these social conditions combine to make our community vulnerable, to make our community disproportionately impacted. And we're seeing this just exploding now with this COVID crisis.
Okay, and we know a glimmer of hope in the fight against COVID-19, of course, is the vaccine. You have been able to vaccinate hundreds of your staff members, but no one in your patient population to this point. What are your thoughts on the vaccine rollout? Do you think it's moving fast enough?
I think it's really great that we have an effective, safe vaccine against COVID in record time. We have vaccinated over 1,000 of our staff members, and our staff are predominantly people of color. We want to demonstrate to our community that this is what we all need to do to protect ourselves and to protect our community and to end this pandemic. And that is to take advantage of the science and of the availability of this vaccine. So we are trying to model that for the community, and we hope that when it becomes available to the public, that our community will step up and get protected.
And, you know, we mentioned that your hospital primarily serves Black and Latino patients. You said that a number of your staff members are people of color. We know that Black Americans are skeptical about the vaccine, in part because of this country's long history of medical abuse and questionable treatment of people of color. How do you address this distrust? And are you using your staff members and them getting vaccinated to try to show others that it's okay?
Yes, we know that there's a history of mistrust of healthcare and of the government, and that we need to educate our community, and we need to show them that the vaccine is safe and effective. We're modeling that by stepping up and getting our own staff vaccinated. I've had a COVID vaccine. As I said, over 1,000 of our staff members have had a COVID vaccine. So we will be directly educating our community. We'll be using social media. We'll be using our chat bot. We'll be using all kinds of modalities to educate our community about the availability and the need to get the vaccine. But we'll also be walking the walk by showing that we were the first to step up and get vaccinated.
An important message to your community there. Dr. Batchlor, thank you so much for talking to us, and thank you for your work on the front lines, and good luck to you.
Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.